Self-Love, Self-Healing, a unique program that's specially designed for you to take care of your holistic health and total well-being. In short, heal yourself, love your life, now and forevermore.
Good morning, Malaysia. Once again, welcome to Durya Nation.
Good morning, everybody.
Yes, hi Shrub.
Hi.
How are you today?
Good.
So once again with self-love, self-healing session and very warm topic today.
Yeah.
That's something called healing hearts.
Yes. Something to do with our heart.
Yeah. And I know that world has tremendously or technologically advanced the techniques of healing heart.
Okay.
Or preventing the heart disorders and diseases. Today, everyone aware of how we can save the life from the massive cardiac failures.
Okay.
And all those resuscitation advancements being given into ambulance.
Yeah.
And within few seconds or few minutes, we have an air ambulance. Which can reach to your place if you can afford to pay.
Oh.
I mean, of course, it's always...
But still, a lot of sad incidents suddenly happen like that, no? When they say a football player, they play, they're very strong body, very healthy.
Yeah.
Suddenly it happens.
Ironically, yes, actually, that's the irony of it.
Why is the reason, actually, for this kind of thing?
You see, we become very monotonous. We become very automatic.
Okay.
We become very robotic. Where the body is not robot. And that's the thing.
We overuse the body, over-exhausted.
Yeah. We thought that we can calculate the body. We thought that we can
manipulate it.
Manipulate and fabricate, and we try to always manage the body as like a mathematics.
Like a machine also.
Like a machine. Which is not happening exactly.
Okay.
With the mathematics, you can have a certain limits only. But you will not create that rhythm of your ECG, which is not actually mathematically, but it is more emotionally being managed.
Okay.
Right? So when we use the mathematical calculations to counting our things or parameters, that's where you become the robot.
The quantify, everything is quantified.
Yes, you're trying to quantify, you're trying to calculatively doing, because after that calculations, after those all effects, you will find that you are turning towards the emotionless body, or you are turning towards the non-living body.
Yes.
If I would use the word non-living,
Like
because if you are living, you must show that emotions, you must show that empathy, sympathy.
Correct.
Those feelings are supposed to be there.
Yeah.
So if I say, it will not be hyperbolic, that without emotions, you are creating your heart disorders. If you put the emotions together, if you put the feelings together since the beginning, so then you don't find the problem related to the heart.
Okay.
Right?
Okay.
So that's one of the very important point for our audience to understand today, that how can we heal our emotions to rectify our problems of heart.
Or another question is that what kind of emotion is good for the heart, and what kind of emotion is bad for the heart?
It's quite debatable because very subjective.
Subjective, okay.
Right? Something may be good for you but not good for me.
Okay.
Right? So if we will go a bit further up and we will not classify as a good and bad,
Okay.
but to understand the emotions only.
Okay.
Right? So if emotions we understand means we are not getting trapped with the even it's a sad or it's a happiness.
Okay.
But in both the scenarios, your emotions are balanced.
Yes.
Once the emotions are balanced, you find that your very important part of your body is endocrine system, which is regulating the hormones.
Okay.
Hormones are balanced. Once the hormones are balanced, you find that body system will not fluctuate. Your cardiovascular system or your heart system will not reflecting to that.
Okay.
Right?
I remember there's a psychological term called flow. So it is in a positive psychology. A flow state is where where being in the zone, where our mental state or our emotions are in how to
Control.
say, for a person, you're performing an activity or fully immersed in the feeling. They're energized, focused, but fully engaged, but they enjoy the process.
Enjoy.
That means that
Very
you're
important
not stuck,
word.
You're not stuck in
Yes,
anything.
yes.
So the heart will not be troubled
Affected.
by.
Yes.
So whatever emotion comes, you can digest it. You flow with it,
Yes.
with your life.
Exactly.
So this is a very beautiful, I think.
Yeah.
term.
You see, our heart rate, it is rhythmic.
Rhythmic, yeah.
You know,
Yeah.
it goes like, you see the
a
ECG
flow, yeah,
also, it has 4 different types of slopes,
Yes,
and it goes rhythm. But when the moment it becomes the asystole, means where the life is end, it becomes a straight line.
Yeah.
So life, even it not any straight line.
Yeah.
Why we want to make it straight?
Correct.
It has to be unplanned,
Correct,
as the ECG used to.
Yeah.
You see that it's also the unplanned.
Yes.
It looks zigzag motions,
Zigzag.
right?
Yeah.
So it's very unplanned.
Yes.
So similarly, our life, but the brain plays a very important role over the heart.
The ego start to
Yes.
intervene.
Yeah. So you control everything from there. And with that controlism, the things get more and more suppressed.
Yeah.
Things means the emotions. That getting suppressed. It looks very philosophical that a child wants to eat an ice cream and then suddenly you said, no, we shouldn't eat ice cream. Why? Why I shouldn't eat ice cream? No, you may get this, you may get that, you may get that. I mean, so many problems you have said. Or maybe you also say that how to prevent, how to save money. So many things you have said.
Yeah.
Child wanted to get a joy by just having a piece of ice cream.
Yes.
Maybe he won't eat also full. He will just take a one scoop and throw off remain.
True.
But then by restricting him there,
Yeah.
something happened over
Negative
there.
emotion.
Negative
It's
emotions.
even more harmful than the harm done by the ice cream.
Exactly. So we are not aware of our spoken words, which is also in our surroundings and in our environment, and these are responsible or they reciprocate to similar type of emotions
Yeah.
to generate those emotions because the energy is as such.
Correct.
And we are receptive to energies. We are receptive to energies. Our vibrations are receptive to energies.
Yep.
So when we catch these, these things we never discuss in our medicine and disease system.
Yeah.
That is the problem.
Correct.
When we discuss about these things, we know that how we can handle this.
Yes.
Simply you are getting outcome only. When we talk into the cardiologist or in cardiology, we will see the 2D echo has been done, or maybe before that the stress test has been done, before that ECG has been done, and they are ruling out something, and then finally the cardiogram says that you have a block.
Yes.
So now you have to go for angioplasty or maybe the open heart surgery or whatever they're trying to rectify, and then after that bunch of medicines been given to continue for whole life.
Yeah.
That's the end of the life.
Correct.
Right? So what can be done in this scenario where the people can find the faith? Because when we talk, they talk to the cardiologist and they say that okay, cardiologist will he is doing so many surgeries, so definitely there are risks to the heart. So to avoid that risk, we take another big risk to continue the life with the drugs whole life.
Yeah.
You will continue taking that medicine. You surrender your whole body to that medicine.
True.
That I will take these medicines and every day.
Yeah.
So is it right, or is right to better take a risk of your life and don't go for any surgery, any medicine, and continue? This dilemma is going on today.
Yes.
This is also a creator of heart problem.
Yeah.
If a person who is suffering with a small condition of a heart problem and met to the cardiologist or certain people who are making him in more dilemma, go not to go,
he's like
do not to
split,
do, and then he will suffer more.
He suffer more
Because nobody is giving him the right answer. I have certain cases where the cardiologist, even they themselves said that we will continue with the medicine. We don't go for surgeries because your vessels are thin and probably it will be harmful if I do the operation, even for the young people. So that's a fact. Then you ask him, so how long I have to be on tablet? And 3 arteries are 100% blocked. So doctor, do you think that I'm going to survive? If yes, then how long? All these questions are unanswered.
Yeah.
So are we saying the cardiologists fail? That they can't give the answer to this type of questions? Or there is a 100% limitations for cardiology to think beyond from this?
The current system.
Yes.
The current,
current
way
system.
of thinking. Yeah.
Yes. So yes, answer is yes. The people who are suffering, they need to find out their answer. Not to blame cardiology, not to blame the cardiologist.
Take responsibility for your own
of
health.
your own
Yeah.
self. Yes, that is the answer today's world is looking for.
Yeah.
That they must understand how and what evolved this type of health condition in your body. Where you went wrong 5 years before or 10 years before to create today's world where you are today.
Yeah.
In your body.
Yeah.
So when they understand that evolution, then only they can dismantle that.
Yeah.
By using
certain
tools.
trauma he have go through, he
Yeah.
keep it in the heart.
Yeah.
He doesn't hear
Yeah.
that part yet. Yeah.
Of course, the resentment is one of that.
Resentment,
anger,
revenge,
all those negative,
vengeful thoughts,
jealousy, mortifications, aggressiveness, many times dogmatic behaviors,
self-criticism and
yes,
hatred of other
self-pity,
people,
yeah. These all things are enough to change our hormonal cycles.
Yeah.
And then we find the disease diagnosis like the left ventricle dilatation or the cardiomegaly or such type of conditions may arise, but it never happened overnight.
True.
It took a long time period, the passage of time, maybe 1 year, 2 year, 10 year, 5 years, depending on the situation of a body.
Yeah.
But it does take time.
True.
So from this reaction, we can revert back if we understand ourselves and we love towards change rather than repeating the same. If you
change
need
the pattern.
if you need to leave your job to correct your heart, kindly do it.
True.
Because if you have a
Heart is
life,
more
you
important.
can find any other livelihood rather than cursing and going every day the same repetition of the job.
Yeah.
And then you say, why I'm getting this problem? Why I'm getting that problem? We need to understand here the body works with the mind.
Yeah.
There is nothing called two different things.
True. Mind, body.
So
Psychosomatic, right?
Psychosomatically.
And then that's why the Dalai
This
Lama
is-
always say,
Yeah.
if you have love towards yourself and another, if you have warm-heartedness, he says,
Yes.
if your heart is warm,
Yeah.
then your heart is healthy. Your whole person is healthy.
Yes.
Look at him; he's always smiling, always relaxed.
Exactly. Very
That
true
kind
what
of-
he said.
Yeah.
Yeah. 100%
And you tend
truth.
to be very humorous, creative,
Yeah.
and you always in the flow.
Yeah.
always in the
Yeah.
flow.
And
Yeah.
that is the life.
Yeah.
The life is a flow
Yeah.
of joy.
Joy, joy,
And that's
joy and bliss.
Yes. Yeah. So this is the basic point here, where when we prescribe in homeopathic medicines to cardio patients or such type of conditions, where there are medicines where the doctors have written and said that it can remove or it can dilute the plugs or the blocks of the arteries. And patients can be better. Of course, we won't treat the patients who are referring to CCU or cardiac care units.
Yes.
But the patients who walk to my clinic and willingness shows towards that want to take some homeopathy or some other alternative medicines, we will take care of that case.
Yes.
And along with that, if they are taking any other allopathic medicines, or probably they have already been diagnosed and they have high blood pressure or they have some other problems, so we try to see and we give homeopathic medicine
At
to
the same time.
make at the same time we give to improve the health from here to more better state.
And then slowly reduce the medicine. There.
Yes, if their condition is getting better and manageable, then we try to reduce the reduce the toxic the drug medicines. Right? And also sometimes we notice the like conditions where when they have this initial condition of heart pain or anxiety issues, nervousness issues, these things are also contributing factor for the heart health.
So what is connection between our high our blood pressure and heart? Can we say that if your blood pressure is okay, then your heart is okay, or vice versa? Is there a direct connection between these two?
There is a connection because if your heart is not pumping, then you don't find the blood pressure has enough circulation of blood.
Mm.
So when the heart contracts, that's how the blood flow starts.
Okay.
And that arterial blood flow, the blood which is flowing into the artery, there is a pressure exerted.
Okay.
That pressure is the blood pressure.
Oh, that
Right?
means if your blood pressure is okay,
Ha.
that means your heart is okay.
Yes.
Oh, okay.
Yeah.
Oh.
Yeah. And but sometimes heart itself as a organ also need to be taken care of.
Mhm.
So in a heart we have 4 chambers, and in those chambers, in between blood to pass through, there is a cannula, and that is known as also the valves. So those valves sometimes get damaged as the passage of time, or maybe because of the old age, or because of some many other reasons are there.
Yeah.
So then you find that we do the it is called as like a valvectomy, or removal of the valves, or transplantation of new valves, biological valves. And so these all things also need to be taken care. Then at the end you find also that sometimes the muscles of the heart getting weaker due to certain reasons. So then we put up the pacemaker over there,
Okay.
which will generate the electricity to the muscles of the heart.
Yes.
Right? And it start contracting. So you see, heart itself as one organ also got so much of other problems to manage.
Yes. Exactly.
Apart from it has to throw the blood to the whole body. You know,
True.
so that is very big responsibility, because each organ will only survive when they have a blood, ample amount of blood.
So heart is the heart of everything.
Yes, exactly, is the heart of everything.
Yeah.
So that's where whenever we are thinking wrong, whenever we are thinking something negative, something which is sedating us or giving us more sadness or depression,
Heartache. Yeah.
heart will eat everything. And then we find why what we say, saket hati, yeah, hati saket.
Sakit. Yeah, that's so true.
Yeah.
True.
So that's something which is very important. How to be joyful all the time.
Yes.
How to be blissful all the time.
Warm-heartedness, yeah.
Warm-heartedness.
Yeah, warm-heartedness, yeah.
Open
Open heart.
Open heart.
Open mind. Yeah.
Yes, open mind. Many times it has been also acknowledged that one has to be more generous in their task. And
In giving,
in
giving and forgiving.
giving and forgiving,
Yeah.
and do not keep so much of load into the brain.
Yeah.
That it start
Go
shaking
to
your
feel
heart.
feel more rather than think more.
Yes.
Yeah.
And the fear factor also work here a lot.
Yes.
Huh?
I think
You
so.
will see the fear factor like somebody who is very fearful, fretful, so that directly sensitive. Directly it will affect to the heart.
The heart
muscles
becomes
and
shrink,
heart.
yeah?
Yes, yeah.
Okay.
So and then that becomes the incident where people always feel that if they are fearful, they will not get the healthy heart.
Yeah.
Because of the emotions.
And they don't have a courage and confidence.
Yeah, they
to face
get like a timid.
and, timid.
Yeah, more timid type. Yeah.
Yeah.
So
Chicken-hearted. That's why.
Chicken-hearted.
Chicken-hearted.
Yes. It's very
Yeah.
rightly said. Huh?
Yeah. Okay.
So such type of things we always feel that one has to take back into themselves.
Their responsibility.
Yeah, their own responsibility.
I think it's hard. We can talk 2 issues. I think, huh?
Yeah.
Maybe next issue we can talk about heart also.
Yeah.
There's a lot of things to
definitely.
talk about. Yeah.
Oh, yeah. It's a very big topic actually. Cardiovascular system is very broad, and that's how you see the super speciality we have in this field.
Correct. Correct.
Where the doctors will be doing the either the cardiologist or the cardiothoracic surgeons.
Okay.
Both are very specialized designations.
Okay.
And they do a lot of surgeries, and very expensive heart surgeries are there.
True.
And it's a very tedious and very vast and complicated surgery, where 6 to 7 hours, minimum 3-4 hours to 6 to 7 hours they have to work on each patient. And then there's a pre and post condition of the patients to care of. They go to the CCU, then they go to the recovery room, and a lot of work. That is what we're trying to discuss here, that if patients or people or human being can manage themselves so then they don't need to go for all those type of trauma.
Yeah.
Huh?
True.
Just imagine the God has given a beautiful body, and you have to chop that body.
Yeah.
You know,
Operate
it is not easy when we look for the CABG, or it's called the coronary artery block graph.
Yeah.
Right?
Yeah.
So, or the bypass. In open word, and a common
True.
word, we say the bypass surgery. So, in bypass, it's not easy operation. One has to really have a strong heart to go for that type of problem.
True.
It's really tough ties, because pre and post, and after then you will be having the lot of medications for whole life.
Yeah. True.
So our experience with this, that in homeopathy, that we try to manage the very early stage of conditions where we know that the main arteries are not blocked, and we also know that the sub arteries, which is having the branches of arteries, which not 100% block. If cases we have seen where they have 100% block of branch arteries and all, we'll try to check their parameters, whether they are having any other type of problems. If no symptoms we find of the acuteness, then we still continue our medicine. But we time to time we check their all the blood parameters. Like we have cardiac markers. So we check the cardiac markers to see that whether they have a high risk of heart attack or not.
Okay.
Then we have certain type of markers to check their body inflammation, like cardiac C-reactive proteins. These are certain things which we do take care through the blood. And if they have any further appointments with the hospital cardiologist and all, we also fix that every 3 months they should continue. You know, so we work together integratively, and only the medicines, if doctors have given anything, that they will continue along with the homeopathic medicines. What we measure here, like sometimes when they do 2D echo, where we find the ejection infraction, means in 1 minute how many times the heart contract. Right? So normally they say that if it is more than 60, means it's fine, means your heart health is better, 60, 70, 80. But as we are catching the age, or as we are having some other problems with the heart, it may shrink or it may go down like 45. That is still good, but not very good.
Heartbeat, you mean?
No, not the heartbeat. It's called ejection infraction. Means how many times when it contract and relax. So that's the blood flows happen. When the heart muscles will contract. So that is called the ejection infraction. Right? So in that ejection fraction, if it is less than 20 or less than 30, means the patient is getting in a typical condition. And there may be any crisis, because the heart shows that it cannot pump the blood to the body.
Cannot take it anymore.
So many times we notice such conditions, when we start giving our medicine, the heart start pumping more better way. And in future 2D echo, when we see from the cardiologist, and doctors find that the health of the heart is better. So such type of conditions homeopathically we treat. And Shab, maybe they also want to know that what emotion side they should manage, so they may not go into this type of conditions.
I think fear and anger, I think two major emotions, that, and sadness. Deep sadness, fear and anger. If they keep it too much in their heart, then your whole life becomes shrink, become lifeless. So I think it's more important, and also try to love ourselves more, give warmth to your heart, your own heart. So and then there's also some affirmation, like like when you talk to your heart, you say that with every breath I take, I'm sending love and gratitude and healing to my heart.
Wow. That's
I'm loving
really
my
good.
heart. Something like that. I think it's quite good to heal.
Oh yes, yeah.
Talk to yourself. Have a positive self-talk.
So
to heal your heart and your whole body.
Wow, that's great. That affirmation is very good.
Yes.
I think something they must follow the tools.
Yes.
Right?
And I think besides that also maybe meditation and yoga. They should
meditation
do.
And yoga.
Meditation.
Meditation, yoga. Yeah, I think they must do their regular checkup
Yeah.
and do take care of their diet.
Yes.
Huh?
Yes.
The diet is also very important.
Yes.
And sleep is very important.
Yeah, sleep very important. Yeah, true.
They say that if you want your body to be healthy, just sleep 6 hours.
Yeah.
But if you want your heart to be healthy, add 2 hours extra.
8 hours.
8 hours,
okay.
yeah. So if you are sleeping 8 hours, means you are caring of your heart.
Okay.
Right?
Okay.
And heart is also an organ, and organ need a proper care. So we must, actually most of us are not aware of anatomy and the physiology, of course, in layman terms.
Yeah.
But one does not need that much knowledge to understand his own body.
Yeah.
As when you eat, you know that you are not hungry. Where you know about the anatomy and physiology of hunger.
True.
Right?
True. Yeah.
But you understand, similar feeling if we put to heart and to other all organs, believe me, you healed.
Yeah. True.
You know,
True.
because you are talking to your, as you mentioned, you are talking to your body.
Yes.
Body
Have
is
a
what?
dialogue, yeah.
Collection of all the organs.
Correct. You are the owner of it, yeah?
Yes.
You are the master of it.
Put your ownership into that.
Take responsibility for your own health.
of it,
Yeah.
And that's where we find that we can prevent this complicated disorders.
Or even heal or reverse your
reverse
heart
the whole
conditions,
reversibility will be there. Definitely.
Yeah.
It can happen. It is not the magic. It's a science. It's a pure science.
Yes, pure science.
When you can create, you can destroy. That's what all about the science.
You can create, yeah.
Right?
Yeah, there's a solution to every problem.
Exactly. Yeah. So so I think Shrub, as you mentioned that this is a very warm topic,
Big topic also,
a big topic.
We should discuss it in next one
in
as well.
Next session we will be coming up with a more detailed, maybe the therapeutic parts.
Yeah, okay.
Or
the healing part. Yeah.
Healing part, that what should be the techniques to prevent such type of things, as you mentioned about the affirmation. That's one of the key points where you don't need to inhale or invasive treatment. It's just we have to affirm something.
It's self-healing.
So such type of more tools and techniques plus some advices along with the homeopathic medicines.
Okay.
We will come into the next session.
Okay, sure.
Right?
Yeah.
So any other final tips you'd like to say about?
That's all. I think love yourself, love your heart.
Yes, that's a beautiful statement. Love yourself.
Yeah.
That's the injection.
Injection. Be warm-hearted. Be a warm-hearted person. Yeah.
Yes.
Have love and compassion. Yeah.
Compassion
to yourself and to everybody. Yeah.
Yes.
Okay.
So with these words, thank you for the session today.
Yeah, thank you.
Welcome.
Yeah.
Bye-bye.
Bye-bye.
Bye.